Welcome back to our final chapter of Psych C1000, Therapy and Treatment. This image is a group at Camp Pendleton that's part of Ocean Therapy. It's a program that helps vets that are experiencing PTSD. That's just one type of therapy among a wide array of therapies that we now have to help with a wide array of problems. This visual is adult mental health graph showing the percentages between 2004 and 2008. And this graph is of children between the ages of 8 and 15 and the different disorders and how it affects children. Let's start with treatment in the past. We'll give you a little historical background. Historically, treatment ranged from exorcisms and asylums to frankly embarrassing lobotomies. We replace that with deinstitutionalization and now offer outpatient therapy, hospitals, and even surfing camps for vets, which I showed you the image of in the first slide about ocean therapy. 18.9% of U.S. adults experienced mental illness in 2017, and most of those did not get treatment. Types of therapy modalities that we'll talk about are individual therapy, which is one-on-one, weekly tailored goals, group therapy, shared issues, less shame, more support, couples therapy, improved communication and resolve conflicts, family therapy, which brings in the entire one family. That was a joke. Mental illness used to be explained by demonic possession, imbalanced humors, and the old classic, your uterus is roaming the body, looking at you, hysteria. Cue the rise of the asylums, where treatment often meant chains, ice baths, and shouting. Enter the deinstitutionalized movement, which was from the 1950s to 70s. The idea that patients deserve dignity, community support, and maybe not lobotomies. Revolutionary, right? Renaissance and Enlightenment, slight progress, still very bleak. This was the asylum era, like Spa Day, but with screaming and no doors. Famous asylums, one was Bedlam in London, where people paid admission to watch the mentally ill perform. Reality TV's great-great-grandparent. Treatments, bleeding, purging, spinning chairs, and isolation. Because why treat suffering when you can spin it really fast? The 18th to 19th century, reform-ish, Philip Pinel, France, and Dorothea Dix in the US said, hey, maybe don't treat people like furniture with rabies. They fought for human treatment, open wards, and fresh air, not electric shock in a basement. But don't get too excited. We still had moral therapy, good vibes only or else, rest cures, especially for hysterical women, basically enforced naps, and institutionalization, overcrowded, underfunded, and still mostly depressing. As discussed earlier, Philip Pinel was one of the people, including Dorothea Dix, that we'll get to on the next slide, that fought for people to be treated more humanely. And he was from Paris. Dorothea Dix was in the US. She also fought for more humanity, and she was the first American to be instrumental in creating asylums that were more humane. The asylums were not clean. They didn't really treat the ill, and there was no goal. So they usually spent their entire lives in these institutions. The mid-20th century included medications and movement. In the 50s, the first antipsychotics, Thorazine was one, were introduced to help control symptoms. From the 60s to 70s began the deinstitutionalization. Patients were released into communities that were not ready. Result was a huge shift in mental health care without a matching shift in the infrastructure. Translation, many ended up homeless or incarcerated, so not exactly a well thought out plan. We've come a long way from drilling skulls to CBT worksheets, but the past is a powerful reminder. Mental illness wasn't always treated with care, respect, or even basic common sense. Now we'll talk about mental health treatment in the modern world, where options are abound. Stigma is slowly melting, and the couch is now virtual, plush, or optional. We're going to talk about what actually works, who provides it, and what you're supposed to do with all these emotions besides bottling them until Thanksgiving. Today, the focus is on short-term care. Involuntary treatment is where you're mandated to get therapy of some sort, not because you chose to, because you're required to. Voluntary, you're choosing to seek treatment. Different types of treatment include community mental health centers, private or community practitioners, school counselors, school psychologists, school social workers, and group therapy. Providers include psychologists, psychiatrists, clinical social workers, marriage and family therapists. The different types of treatment: psychodynamic, play therapy, behavior therapy, cognitive behavioral therapy, humanistic therapy. We will start with psychoanalysis. Psychoanalysis was invented by Sigmund Freud. It's a long-term insight-based therapy that aims to uncover unconscious conflicts driving your thoughts, emotions, and behaviors. Simply put, let's talk until you accidentally remember what broke you. Some key features: free association. You talk about anything without censoring. Eventually, your brain slips and Freud goes, aha! Dream analysis. Dreams are the royal road to the unconscious, or at least to bizarre metaphors involving staircases and repressed feelings. Transference is you project your issues with your parents onto your therapist. Your therapist nods, knowing it's working. Resistance. When you avoid certain topics or miss appointments, Freud would say your unconscious is playing defense. You, I don't want to talk about my father. Freud, exactly. Let's talk. Psychoanalysis is not as common or preferred today by many people. Psychodynamic is talk therapy based on the belief that the unconscious and childhood conflicts impact behavior. Here's an image of a classic couch that you would lay down on during psychotherapy. Play therapy. Play therapy is a structured, theoretically based treatment that uses play to help children express thoughts and emotions that they may not be able to articulate in words. Because let's face it, most 6-year-olds aren't going to say, well, I believe I'm manifesting internalized anxiety due to disrupted attachment patterns. No, they're going to throw a plastic dinosaur at a dollhouse and say it's all falling apart. And then my friends is the breakthrough. Children naturally communicate through play. It's their language. It's non-threatening, familiar, and allows them to process trauma, fear, or stress symbolically. It offers a safe space to express things they don't even know they feel yet. Non-directive, child-centered play therapy is where the child leads, the therapist observes, reflects, and provides a safe environment. Motto, follow the child, they know where the dragon lives. Directive play therapy, the therapist introduced themes or activities to guide healing, like role play, storytelling, or drawing specific events. Great for trauma, anxiety, and grief. Some other therapies are art therapy, where you paint it out or sculpt. Sand tray therapy, tiny figurines, big emotions. Therapeutic games like Uno, but with feelings and slightly fewer table flips. Play therapy teaches us something adults forget far too often. Healing doesn't have to be serious to be significant. Sometimes the path to mental health starts with a puppet, a sandbox, and someone who's finally listening. Behavior therapy is rooted in learning therapy and the bold assumption that feelings are fine, but behaviors are facts. It focuses on changing observable actions using the same principles you use to train a dog or a roommate who never does the dishes. If it worked on rats and pigeons, surely it can help you stop biting your nails or freaking out in group chats. Classical conditioning, Pavlov style, associate a neutral stimulus with a response. Fear of dogs, let's break that link with adorable corgis and calm breathing. Operant conditioning, Skinner style, behavior increases or decreases based on consequences. Did you just get a gold star for not punching your coworker? Yes, you did. Exposure therapy, you face what you fear in a safe, controlled way. Start with photos, move to videos, eventually pet the spider. The fear shrinks and you gain bragging rights. Systematic desensitization, you pair relaxing techniques with gradual exposure. You're anxious, then calm, then confronting your fears like a budget superhero. It's good for phobias, anxiety, ADHD, substance use, OCD, behavior problems in kids. Behavior therapy doesn't ask, why are you anxious? It asks, how do we wash that anxiety off your brain like bad graffiti? Behavior therapy reminds us that change doesn't have to be mystical. Sometimes it's as simple as unlearning the fear, reinforcing the calm, and high-fiving yourself for walking past the dog without crying. Mary Cover Jones is the mother of exposure therapy. She's a woman who made a toddler unlearn fear faster than you unlearn high school algebra. Exposure therapy is based on classical conditioning, as discussed earlier. It works by gradually and safely exposing someone to what they fear until the fear loses its grip. You basically teach your brain that it's reacting, and the spider mall awkward eye contact isn't going to kill you. Avoidance feeds anxiety. Exposure starves it. Mary believes something like this. What if we help people stop being afraid by showing them the thing they fear in tiny, tolerable doses while making them feel safe? This was radical and also adorable. The case of little Peter and the fluffy saboteur. Peter was a 3-year-old boy terrified of white rabbits and anything fuzzy. Jones brings Peter closer and closer to the bunny while feeding him his favorite snack. Over time, Peter's brain rewires. The bunny equals cookie time. Bunny does not equal a soul-sucking demon. This technique is now called counter conditioning. It's a form of exposure therapy. She did this decades before behaviorism got trendy. Take that, Pavlov. Mary Cover Jones didn't just hand out cookies, she handed us a blueprint for bravery. She taught us that fear isn't permanent, that the brain can be reprogrammed, and that sometimes healing starts with a snack and a bunny. Continuing with exposure therapy, we're going to talk about Joseph Wolpe. He was the father of systematic desensitization and the guy who made therapy chill. He was a South African psychiatrist who really hated anxiety. In the 50s, Wolpe revolutionized therapy by developing systematic desensitization, a way to make fears less scary, one calm breath at a time. Think of him as the Bob Ross of behavior therapy. We're just going to gently confront that fear, just a little anxiety here, no mistakes, only exposure opportunities. He had a structured 3-step method to treat phobias. Relaxation training, teach the client how to fully relax, breathing exercises, progressive muscle relaxation. Then you list anxiety-inducing situations from least to most terrifying. Look at the photo of the spider, watch a video of a spider, be in the same room with the spider, share an apartment lease with the spider. Lastly, gradual exposure with relaxation. You start with the least scary thing while staying relaxed. Work your way up the ladder. Fear starts losing its grip because you can't be relaxed and panicking at the same time. That's called reciprocal inhibition, and it's science version of choose your fighter. Wolf basically said, let's trick your nervous system into not freaking out anymore. Joseph Wolf took fear by the shoulders, looked it in the eye, and said, you don't have to control me anymore. He helped us replace panic with peace, one step at a time. Behavior therapy reminds us that change doesn't have to be mystical. Sometimes it's simple as unlearning the fear, reinforcing the calm, and high-fiving yourself for walking past that dog without crying. It uses operant conditioning, based on the principle that behaviors become extinguished when they're not reinforced. It uses token economy, points, tokens, or gold stars earned for good behavior. They use it in schools, clinics, and surprisingly competitive family homes. It's good for phobias, anxiety, ADHD, substance use, OCD, and behavior problems in kids. Cognitive therapy. Because sometimes the biggest bully in your life lives between your ears. It was created by Aaron Beck in the 60s. Cognitive therapy focuses on changing distorted thought patterns that lead to emotional distress and self-sabotage. Think of it as brain debugging. Find the glitch, reframe it, rerun life without the mental crash. It's all about the cognitive triad. First, negative views about yourself. Second, negative views about the world. Third, negative views about the future. You, I'm terrible. Everything is terrible. I'll always be terrible. Beck, okay, let's go ahead and challenge all of that. Core concepts in cognitive therapy include automatic thoughts. These are the snap judgments your brain makes without your permission. Spoiler, many of them are not helpful and definitely not true. Secondly, cognitive distortion. Beck gave us the greatest hits of thinking errors like catastrophizing. If I mess up this one meeting, I'll be fired and living in a dumpster by Tuesday. Overgeneralization. I failed once equals I'll always fail. Personalization. Someone's in a bad mood. It must be my fault. Black and white thinking. Either I'm perfect or I'm a failure. Beck's therapy helps you find these, question them, and replace them with thoughts that don't actively ruin your day. The therapy part, what actually happens, you identify the thought, you examine the evidence, you replace the distortion with something more balanced, you practice, repeat, get emotionally sturdier than a therapy horse in a windstorm. It's not toxic positivity, it's just accurate thinking with less sabotage. It's good for depression, anxiety disorders, substance use, eating disorders, OCD, and any situation where your brain is being rude and unhelpful. Cognitive therapy reminds us that just because a thought feels true doesn't mean that it is. And if your brain is a mean little narrator, it might be time to rewrite that script. Here's a visual of cognitive therapy thinking. Moving on to cognitive behavioral therapy. CBT is a widely used evidence-based psychotherapy that identifies and challenges irrational thoughts, the cognitive distortions, changes problematic behaviors, teaches coping skills, doesn't require you to talk about your childhood unless your thoughts blame your goldfish for your anxiety. Basic ideas, thoughts, to feelings, to behaviors. Cognitive distortions you might recognize. All or none thinking. If I don't succeed perfectly, I'm a failure. Catastrophizing. If I mess up this presentation, I'll lose my job, become a hermit, and live off canned peas. Mind reading. They didn't text back. They hate me. Definitely plotting my downfall. Should statements. I should be happier, should be more productive. I shouldn't be watching cat videos at 3 a.m. Yet here we are. What happens in CBT? Your therapist helps you identify irrational thoughts, challenge them with evidence, replace them with more realistic ones. You practice new behaviors that align with your new mindset. It's like putting your brain through basic boot camp minus the yelling and emotional push-ups. CBT can help with depression, anxiety, PTSD, OCD, eating disorders, insomnia, basically everything that starts with I overthink everything and now I'm sad. CBT is the gold standard of modern therapy, not because it's magic, but because it teaches you how to think in ways that don't sabotage your entire life. Turns out you can change your mind, literally. Humanistic therapy, where self-actualization isn't just a buzzword, it's a vibe. Let's talk empathy, growth, and why your therapist might sound like a life coach who reads poetry. It's therapy that focuses on your conscious experience, your capacity for growth, and your actual feelings, not the ones that you think you're supposed to have. It was developed by the ever-so-feeling Carl Rogers and other philosophical lovebugs of the 50s. Humanistic therapy believes you're not broken, you're just blocked. Carl Rogers and client-centered therapy. No patients here, you're a client, which sounds way more empowered and slightly less contagious. It includes unconditional positive regard. I accept you completely, even if you ate 42 bagel bites and ghosted your cousin. It also includes empathy. Not that sucks, but I feel the ache in your chest like it's mine. Genuineness as well. The therapist is real, no hiding behind a clipboard or Freud quotes. You talk, they reflect, you grow. You cry, they nod, you grow more. You self-actualize. Suddenly, you're signing up for pottery classes. It's great for low self-esteem, depression, existential dread, grief, identity crisis, or post-breakup epiphanies. Anyone who's tired of being diagnosed and just wants to be seen, humanistic therapy is for you. It teaches us that healing doesn't come from fixing, it comes from understanding. It's not about changing who you are, but realizing that who you are might just be enough. Biomedical therapies. The treatment approach for when your brain chemistry needs a little pharmaceutical encouragement. These are treatments that focus on biological basis of psychological disorders. Instead of asking, how do you feel about that? Biomedical therapy asks, have you tried SSRIs? It's medicine, devices, and occasional electrical impulse, all in the name of mental health. Psychotropic medications, also known as the chemicals that whisper sweet nothings to your neurotransmitters. Antidepressants, usually SSRIs, boost mood, reduce anxiety. Side effects can include dry mouth, dizziness, and wondering if it's really working yet. Anti-anxiety medication, benzodiazepines, fast-acting calm in a capsule, risk, addiction, dependence, and a nap that lasts 3 business days. Mood stabilizers, used for bipolar disorder, lithium, the OG mood leveler, but watch those blood levels, this ain't Flintstone vitamins. Antipsychotics, they treat schizophrenia and severe mood disorders. Older types, Thorazine, zombie side effects included. Newer ones, atypical, fewer side effects, but fewer equaling none. Stimulants for ADHD help focus, reduce hyperactivity, and occasionally turn you into a productivity wizard. ECT, or electric convulsive therapy, shocking, yes, brutal, not anymore. Used mainly for severe depression that resists everything else. You're anesthetized, your brain gets a mild electric jolt, and somehow you get relief. Transcranial magnetic stimulation, or TMS, is magnets on your head stimulating your brain. No surgery, no shock, just electromagnetic pulses trying to get your mood out of the gutter. DBS, or deep brain stimulation, is rare, invasive, and futuristic. Electrodes are implanted in the brain for chronic cases of depression or OCD. It's like your brain gets a pacemaker, but for sadness. Pros: fast relief for many conditions, can be life-saving, helpful when paired with talk therapy. The cons: there are side effects, stigma, and there is a trial and error process. Biomedical therapies remind us that mental illness isn't just illness. Sometimes healing takes more than talking. It takes chemistry, careful monitoring, and the occasional zap. And that's perfectly okay. Treatment modalities, because when it comes to mental health, one size absolutely does not fit all. It's the method or approach that's used in therapy to treat psychological issues. Think of it like ordering from a menu. What's the client dealing with? What's the therapist trained in? Do you want to talk it out, rewire your thoughts, or zap the sadness right out of your hippocampus? The main categories include individual therapy, which is one-on-one, just you, your therapist, and your spiral. Used for most conditions: depression, anxiety, trauma. It's private, personalized, and have plenty of opportunities to cry in a comfy chair. Group therapy: several clients with similar issues and one therapist. It's more affordable, more support, and a chance to realize you're not the only one who spirals over texts left unread. Bonus: you get to role play coping strategies with strangers. Family therapy: the whole chaotic crew shows up. You focus on improving family dynamics, communication, and reducing the number of silent dinners and passive-aggressive post-it notes. Couples therapy: you and your romantic partner learn to communicate, resolve conflict, and figure out why loading the dishwasher is a metaphor for unresolved resentment. It's not about who's right, it's about surviving IKEA furniture assembly together. Treatment modalities aren't just tools, they're the map, the method, and the mood. Whether you're diving deep, rewiring your thoughts, or just trying not to scream into the void, there's a therapy style that fits your struggle. Addiction: a condition where your brain decides dopamine is the only emotion worth feeling. And today we're talking treatment, because just stop has never, in the history of ever, actually worked. So what are we dealing with when we're talking about addiction? Substance-related disorders involving drugs, alcohol, nicotine, or caffeine, and behavioral addictions, which include gambling, internet shopping, TikTok, anything your brain can compulsively chase for temporary relief and long-term regret. Addiction is chronic, relapsing, frequently misunderstood, and absolutely not a moral failing. Treatment approaches, not just rehab montages. Detoxification: the first stop on the recovery train. Supervised withdrawal, because going cold turkey without help is dangerous. Usually it's done in a medical setting with enough fluids, nurses, and regret to power a small solar farm. This slide is the National Survey on Drug Use and Health. It shows trends in the prevalence of various drugs for ages 12 to 17, 18 to 25, and 26 and older. The next treatment approach is behavioral therapy, because addiction isn't just physical, it's behavioral. Enter CBT, motivational interviewing, and contingency management. CBT: let's challenge those thoughts like I need this to function. Contingency management: do healthy stuff, earn rewards. Motivational interviewing: help the client convince themselves to change while the therapist nods wisely. Medication-assisted treatment, because your brain isn't going to rebalance itself. Some common meds: methadone and buprenorphine, naltrexone, and disulfiram. MAT or medicated assisted treatment is often misunderstood. No, it's not substituting one addiction for another. It's called stabilizing brain chemistry with supervision. Addiction recovery isn't just about quitting, it's about rebuilding. It takes therapy, support, and sometimes medication, but mostly it takes showing up, even when your brain screams, nope, because healing is possible even when it's messy. So, what makes treatment effective? Spoiler alert, it's not just comfy chairs, soothing voices, and an artfully placed box of issue. Though, let's be honest, those do help. So let's say you're in therapy or thinking about it, or you went once and decided it wasn't for you because your therapist blinked too much. But before you ditch the whole enterprise, let's talk about what actually makes therapy work. Because, spoiler alert, it's more than the modality, it's also the magic ingredient that research keeps shouting about. The Therapeutic Alliance is number one on the list of actual healing ingredients. Translation, you trust your therapist, you feel heard, and they don't make you want to claw your face off mid-session. A good bond does not say that they agree with you. A good bond says they challenge you without making you want to ghost them. The duration of treatment for an addict should at least be 3 months. Holistic treatments address multiple needs, not just the addiction. It also will address stress management, communication, relationship issues, parenting, vocational concerns, and any legal concerns. Group therapy and 12-step programs. Welcome to the circle. Here's your coffee and your shared trauma. AA, NA, and other groups provide community, accountability, and that sweet, sweet fellowship of people who get it. They can relate. Spiritual component is optional. Support group snacks, sadly, also optional. Parental involvement is also a factor in helping the treatment stick. Therapy works when the ingredients line up: trust, effort, good science, and the willingness to try again and again. You don't need to be perfect. You just need to keep showing up, because healing doesn't happen in a straight line. It happens in squiggles. The sociocultural model, because what if your so-called disorder is just a perfectly rational reaction to cultural expectations, chronic discrimination, and that one aunt who keeps asking, why are you still single? The sociocultural model says mental health is deeply influenced by culture, social norms, race, ethnicity, gender, poverty, discrimination, religion, whether your family thinks therapy is just for Americans. Basically, it's a therapy worldview that shouts, context matters. People don't live in a vacuum. They live in societies. And societies are filled with pressure, judgment, stigma, and unequal access to healthcare. Your anxiety might not be irrational if your environment is, in fact, completely unhinged. Implications for treatment. Cultural competence is key. Therapists must understand the client's background, or at least not assume everyone journals and drinks herbal tea. Community-based interventions can be more effective than individual therapy. Therapy must adapt, not expect the client to do all the adjusting. Translation. If your therapist keeps asking why you're afraid of independence, but you live in a collectivistic culture, they might be projecting their own individualism. The sociocultural model reminds us your struggles aren't just internal, they're shaped by your society, and until we treat the culture as much as the symptoms, we're just rearranging deck chairs on the Titanic. So let's explore why getting mental health treatment is often harder than needing it in the first place. Whether it's stigma, money, time, or just trying to find a therapist who actually calls you back, these are the barriers that keep too many people stuck in the struggle. Some barriers include financial constraints. Therapy ain't cheap, folks. Insurance, often confusing or non-existent. Co-pays that feel like rent. Medication that costs more than your monthly coffee addiction. Stigma. Therapy is for crazy people. Real men don't talk about your feelings. In this family, we don't do emotions. We do sarcasm and denial. Stigma is cultural, generational, and internal. Third, access issues. Rural areas, mental health deserts. No transportation equals no therapy. No internet, good luck with telehealth. Waiting lists are so long. Number 4, lack of mental health literacy. Many people don't know the signs of mental illness. I thought I was just lazy equals actual quote from somebody with undiagnosed depression. Language and cultural barriers. No therapists who speak your language. Cultural mismatch. You're looking for understanding. They're suggesting yoga and quinoa. Fear of being misunderstood, or worse, judged. Timing and scheduling. People work, people parent, people survive. Finding a weekly hour to unpack your trauma isn't always feasible. Mistrust of the system, especially prevalent among historically marginalized groups. For good reason, past abuses, discrimination, and the lovely tradition of over-pathologizing people of color. Trust takes time. The system, often impatient. So what do? We normalize therapy, expand affordable access, train culturally competent providers, build support outside the clinic. Community organizations, peer counseling, hotlines, memes that say, hey, you're not alone. Seeking help shouldn't feel like a marathon with emotional ankle weights. The barriers are real, but so is the hope. Keep pushing, keep asking, keep showing up, because you deserve support no matter what stands in your way. That concludes Chapter 16, Therapy. That also concludes our course. I hope you enjoyed all of our lectures.